Hey, welcome to The Explainer. Today we're going to break down Insulin Aspart. It's a really important, rapid-acting insulin and a key tool for a lot of people with diabetes who need to manage their blood sugar right around mealtimes. So, if you have diabetes, you know this struggle all too well, right? Trying to manage those blood sugar spikes after you eat, it can feel like a constant balancing act. Okay, let's dive right in and talk about how Insulin Aspart fits into that picture.
All right, first things first. What exactly is Insulin Aspart? Let's take a look at its specific job and how it's designed to help both adults and kids with diabetes. Okay, a great way to think about insulin is like a key. It's the key that unlocks your body's cells, allowing sugar, or glucose, to get inside and be used for energy. Now, Insulin Aspart is a special, man-made version of that key, and it's engineered to work super fast, exactly when you need it most, right after a meal.
So Insulin Aspart is what we call a mealtime insulin. Its whole job is to get a handle on that rush of glucose that comes from the food you just ate. It's usually not working alone, though. It's often paired up with a long-acting insulin. You might hear it called basal insulin. And that one provides a slow, steady stream of insulin all day and all night.
And this is where it gets really interesting. Check out how fast this stuff works. You take it just 5 to 10 minutes before you even start eating, then it hits its peak power in about 1 to 3 hours, which is, you guessed it, right when your body is busy digesting that meal. That incredible speed is exactly what makes it so good at controlling those post-meal blood sugar levels.
Okay, so we know what it is. Now let's get into the really practical stuff. How do you actually use it? Because getting this part right is absolutely key for it to work safely and effectively. You've got to follow these steps every single time. First, and this is so important, always check the label. Make sure you've got the right insulin in your hand. The liquid itself should be totally clear and colorless. If it looks cloudy or anything, don't use it. Then, after you prepare your dose and inject, you have to dispose of that needle safely. And please, never ever reuse or share needles.
All right, where to inject? You're aiming for that fatty tissue just under the skin, so think your stomach area, thighs, buttocks, or the back of your upper arms. But here's the most important habit you can possibly build. You have to rotate where you inject. Seriously, if you use the same little spot over and over, you can get these lumps or dents in your skin. It's a thing called lipodystrophy, and that can actually mess with how well the insulin gets absorbed. So keep moving it around. It helps make sure the insulin works predictably every time.
Okay, let's talk side effects. Because, like any medicine, Insulin Aspart has some potential side effects, but knowing what to look out for is half the battle, right? It puts you in control of your health.
So the big one, the number one side effect you need to be aware of is hypoglycemia. That's just the medical term for low blood sugar. And honestly, it's the most common side effect for any kind of insulin. It simply means your blood glucose has dipped too low, usually below 70, because there's a little more insulin in your system than there is sugar for it to work on.
Now, the good news is your body usually gives you some pretty clear warning signs when your sugar is dropping. You might feel shaky, start sweating, get dizzy, maybe even feel confused or suddenly really hungry or irritable. These are your body's alarm bells. If you feel any of these, check your blood sugar if you can and be ready to treat it quickly with a fast-acting sugar source like some juice or glucose tablets.
Now, there are a few other common things you might notice. You could get a little redness or itching right where you injected. That's usually temporary. We already mentioned lipodystrophy from not rotating your sites, and some people also experience some weight gain or swelling in their hands and feet when they first start on insulin therapy. The important thing is to always talk to your doctor about any side effects that are bothering you or just won't go away.
Next up, we need to cover some really serious warnings. Please pay close attention here, because these are absolutely essential for your safety.
Let's be crystal clear on this one. It's 100% non-negotiable. You should never share your insulin pens or syringes with another person, not even if you change the needle. It poses a serious risk of transmitting bloodborne diseases. Your insulin delivery device is for you and you alone, period.
This one might sound simple, but medication errors can happen, especially if you use more than one type of insulin. So please make it a habit to double-check the label every single time you prepare a dose. That one simple check can prevent a really dangerous mistake.
While it's pretty rare, a severe allergic reaction, it's called anaphylaxis, is a true medical emergency. If you suddenly have trouble breathing, or you notice swelling of your face or throat, or get a rash all over your body, you need to seek emergency medical help immediately.
And here's another serious warning. All insulins can sometimes cause a drop in your body's potassium levels, a condition called hypokalemia. While it's not always an issue, it can be dangerous if it gets too low and is left untreated. Your doctor may want to monitor your potassium levels, especially if you take other medications, like certain diuretics or water pills, that also affect it.
Finally, it's so important to understand that insulin aspart doesn't work in a vacuum. Other medications you take can actually change how it affects your body, and that's crucial for your safety.
This table gives a really great overview. See, on the left, some pretty common medications can actually increase the power of your insulin, which raises your risk of low blood sugar. On the other hand, the drugs on the right can make your insulin less effective, causing high blood sugar. This is exactly why your healthcare team needs a complete list of everything you take, including any over-the-counter drugs.
And this is a really critical point. Some medications, particularly beta blockers, which are often used for blood pressure, can actually mask those early warning signs of hypoglycemia. You know, the shakiness or fast heartbeat you'd normally feel? Well, these drugs can hide those symptoms, meaning you might not know you're low until your blood sugar is already at a dangerous level. So if you take these, you have to be extra vigilant about monitoring your glucose.
Look, while we hope this explainer empowers you with knowledge, it is absolutely not a substitute for professional medical advice. It's so important that you discuss any changes to your treatment plan, whether that's your diet, your exercise, or other medications, with your healthcare team. They are your partners in managing your health.
Asking questions is one of the most powerful things you can do for your health. So think about what you've learned. What's one question you can bring to your doctor at your next visit? Being an active participant in your care makes all the difference. Thanks for joining us for this explainer.